was a really interesting study because we wanted to get a better understanding of how adverse pregnancy outcomes like hypertensive disorders of pregnancy or gestational diabetes that occur just during pregnancy may have implications for long-term cardiovascular health. We looked at a study of about 4,000 individuals who had been recruited in the first trimester of their first pregnancy and had cardiovascular health measures at the beginning of their pregnancy. We followed them through pregnancy and then had them come back for a visit about 4 years after the delivery of their baby. We were most focused on assessment of body mass index at the beginning of pregnancy before there's been significant gestational weight gain related to the pregnancy. Then in the follow-up, what we were looking at were how many people developed hypertension or diabetes. Now, this was a study of young people, so the fact that these individuals were developing hypertension or diabetes even at this young age was pretty remarkable. What we did then was ask the question, did the occurrence of that adverse pregnancy outcome itself change their trajectory and actually lead to worse cardiovascular health afterwards? We used a method called causal inference to try to ask the question, what proportion would maybe be eliminated if that adverse pregnancy outcome hadn't happened? And part of what we found from the study was that a lot of the risk for later life hypertension and diabetes was really already present before the pregnancy. And so developing high blood pressure or diabetes during pregnancy has often been thought of as, oh, once you're not pregnant anymore, it goes away. And while in the short term, blood pressure often normalizes after pregnancy or diabetes often resolves after pregnancy, what we see is that individuals who have these complications are at much higher risk for hypertension, diabetes, and heart disease earlier in life than those who haven't had these complications. So really zeroing in on using this as a red flag and an early opportunity to intervene with healthy lifestyle and medication if needed. We saw that a number of people developed hypertension just in the 4 years after their first pregnancy. This is a really critical period where there are many gaps. We know that women experience different risk factors for cardiovascular disease across the life course. I think pregnancy is a really great example of that, and where Bloom Cardiovascular Institute has really demonstrated great leadership with its women's health program led by Dr. Mendelsohn, as well as its postpartum hypertension program led by Dr. Franey. Programs like this really help focus and bring expertise and have clinicians that are dedicated and focused to serving the needs of patients where they are, particularly in this life stage, when many people may feel like they're very young and may not need a cardiologist. Prioritizing that early prevention is really key.